All right, Matthew Holt with Abner Mason, who's the CEO of Consejo Sano, which I finally correctly pronounced just in time until the name is changing.
It is changed.
To what?
To SameSky Health.
SameSky Health, all right. So, Abner, what is the difference between, obviously the same company, and you're still the same CEO, but what was Consejo Sano doing that, SameSky Health doing that Consejo Sano was not doing?
Well, it's more about sending a clear signal to the market that we serve everyone. When I created Consejo Sano, initially we were going to focus on Latinos, a very underserved population in the U.S. But in building the solution for Latinos, it turns out that the approach we take, which is to treat people like who they are matters, it works for everyone. And so we started to serve everyone, and we needed a name that captured that. And so we think SameSky Health does that.
Great name. So, what does SameSky Health do? I think of you as being the guys who send text messages on behalf of health plans, but what do you really do?
That's you've got it mostly right, that we are an engagement solution. So we help health plans, primarily Medicaid, but also Medicare Advantage and Exchange. We help those plans to engage their members. They really struggle to build a trusted relationship with their members. And what we figured out is that if you understand who people are at a deeper level, and we use technology and data to do that, at that deeper cultural level, you can build a trusted relationship and navigate people into care at the right time in the right place. So that's what we're doing for our plan partners.
Okay, so what are the biggest problems? I would guess number one is getting access to the right kind of care in COVID, especially vaccinations and testing. So tell me about if that's where you're going, and then what else are your plans sort of really saying, we got a problem here, how can you help?
So it's a really good question. Right now, because of COVID, one of the big challenges is getting vaccines in arms, particularly for the Medicaid population. And we have had tremendous success with our Medicaid managed care plans of getting vaccines in arms, because it turns out that trust is a big part of getting people to make that decision, of being able to answer their questions and allay their concerns and just treat them with respect. And that's what we do. We understand who they are, and we're able to navigate them to a place to get a vaccine in their arm. And we're really getting great results in terms of vaccines. But more generally, we're helping our plans to close gaps in care, whether it's Medicaid plans and helping them improve their quality scores, HEDIS measures, or Medicare Advantage plans, helping them improve their star ratings by closing gaps in care. The key is to navigate people into care at the right time in the right place so that they can get that screening. And that's what we are really good at doing.
All right, just to catch up quickly on SameSky, I forget, how much money do you raise these days?
We have so far raised, I think, about 25 million.
Almost nothing.
Compared to others, we are very efficient.
Well, let's talk about how many members, people, Medicaid recipients, patients. So how many are you reaching out to and touching base with?
Today we are engaging about 3.5 million members, mostly Medicaid, but some Medicare and some Exchange. About 3.5 million.
And, we're known for the text messaging. It's the simplest and most easy solution for most people. Are there other places you're going to go, or is the goal to take that text messaging to the other 327 million?
I think our goal has always been to connect with people in the way that they prefer. And what people in America prefer today, the way they prefer to communicate, is text messaging. So there's no question we want to double down on that mode of communication. The problem is, as you know, there's a lot of old laws, antiquated laws, that are preventing us and preventing our Medicaid and Medicare Advantage plan partners from being able to use text messaging, and we need to fix that problem. That's something we need to do in 2022.
Okay, and then lastly, you're obviously deeply involved with the health tax Medicaid community. They had a great session, virtual session at JP Morgan. Tell us what that organization is up to now in terms of, is it helping with laws such as that, and what else is it up to?
So I'm really proud. I was one of the founders of Health Tech for Medicaid, and it's a group that's focused on bringing innovation to the Medicaid market. I think it's doing a great job. Adamika Arthur, the woman who runs it, is doing a great job. What we need is to bring entrepreneurs and innovation to the Medicaid space. For too long, a lot of the money and investors and entrepreneurs focus on Medicare Advantage and commercial. And yes, those lines of business pay more, but the fact is Medicaid is the largest health program in the country. And we need to make sure that we focus on solutions for that part of the population. It's also the most underserved part of the population. So I think that's what Health Tech for Medicaid is doing. It's bringing entrepreneurs and investors together to say, how can we bring more innovation faster to the Medicaid market.
That's a great thing to do, and I'm looking forward to seeing your success there. Congrats on the success with SameSky Health so far.
Thank you.
And thanks for talking.
All right, thanks very much.